I mentioned during my talk, and I also think as an engineer, we are in an industry which is, healthcare, but it's really sick care, but let's not go there too much. But it is also an industry that does not understand its gold standard. Why? Because we are really dealing with patients that come with chronic diseases to us, and then we fix them. So we didn't spend enough time to understand what health is and what is the definition of health. So it's very important that we work on trying, if we want to solve the problem of healthspan or chronic diseases, we have to understand the gold standard. So the best way to understand the gold standard is to measure it and then create ways to measure that trajectory of health across the lifespan, and then define it this way: as you modify the trajectory because you're faced with a certain illness, you right away make a correction. So you don't get to the sick aspect, to the chronic diseases. So I think that's point number one, that we need to define the field first. We need to understand what health is. We need to measure it, and then look at it over time, what it means. People think that we are looking at extending somebody's life or making them live forever. This is not something that's reachable today, and this is not actually our goal. We really are trying to do is compress this whole lifespan to push it into the health span. So let me give you an example what we're trying to do. The average age in the United States, I will say, is around 79 years old. That's how people live, average-wise. And then they end up, starting getting chronic diseases. Chronic diseases develop over a long time. And they start to hit you as you get into this 65, 69, etc. So you end up being hit by these chronic diseases and with disabilities and with a terrible life, and maybe you're crippled in the bed, or you're not feeling very good every day. And it's a long time. So you're going from 69 to 79, 10 years, where you're really not enjoying anything. So we want to change this. We would like to push that and push that chronic disease as much as possible. Let's say we push it to the ages of 90 years old. So you're living now, from the time you retired, let's say you retired, you're living now healthy, you're spending time with your grandkids, and you will get that disease, but you're getting it at the 90 years old, and then you'll disappear. So that would be great if we can achieve that. A sub point of my point number two is, let's say I'm the best scientist in the world, and I created a treatment to eliminate cardiovascular disease. Great. What is this going to do to us? How much you think your lifespan will expand? Will only expand for 4 more years. Why? Because you still have to deal with the other diseases that you have, cancer and neuro. So that's actually what people misunderstand, that we are trying to tackle all these chronic diseases at the same time. This new area that we call longevity or health span, it also being overcrowded by people who are not necessarily scientists, but who are also trying to sell you a product. So they do come up with science that they think, oh yeah, you should take these AG1. This is the best thing since sliced bread. It will extend your life. This is bro science. This is no evidence behind it. So we really need to get into the aspect of communication. We as scientists, not necessarily me, I may not be the best guy to do this, but there may be others who can communicate and talk about evidence-based, about accuracy. Otherwise, this field is going to disappear in the noise. It will be taken over by people who are selling you this best whey protein in the world at a discount of 25%. We are in science, we are anchored in this aspect, and we have to be the one that win this signal. We need to be the signal that will eradicate the noise.